Everybody, Dr. Nick Scotta with River City Physical Therapy, located right here in the heart of Jacksonville. And today I want to talk to you about common misconceptions about Piriformis Syndrome. Now, this is a condition that's often quoted by people and patients as to put the blame onto why they feel either buttock pain, lateral hip pain, sciatic symptoms, so burning, numbness, and tingling down the leg, or just general hip pain that they have. A lot of people point to the piriformis muscle. And the piriformis muscle is just a small muscle in the buttock area that helps kind of rotate the hip. So it's just one of your stabilizing muscles of the hip region. But the fact of the matter is that people commonly attribute pain to this muscle when the pain doesn't actually come from it at all. Because the research shows that only about 6% of the population experiences Piriformis Syndrome, true Piriformis Syndrome. So only 6% of the population. You know, compare that to low back pain, which is typically 80% at any given point in their life will experience low back pain. And one of the things that people do if they feel like they have Piriformis Syndrome is they'll stretch their hip. They'll do a piriformis stretch, figure 4 stretch. Maybe they do some different yoga poses to try to stretch it out. And that may give them temporary relief, but it doesn't give them the lasting relief that they want. So if they're only getting temporary relief from pain with the stretches they're doing, that's a sign that, hey, you may need to look elsewhere for the cause of your pain. Because oftentimes, if you have a muscle that tenses up and causes pain, kind of like the piriformis, you need to ask yourself, okay, did this muscle just tense up and cause pain on its own? Or was there something else that caused it? Usually, when muscles get painful, it's something else that caused the pain. There's a reason why that muscle got irritated and aggravated. But it's usually attributed to something else that's going on, whether it be the SI joint or the low back area. So it's not always the true root cause of why you're getting pain. It's usually just a secondary factor, a tight piriformis. So again, oftentimes, yes, the piriformis does become painful, but that doesn't mean it's true textbook Piriformis Syndrome. It just may be a secondary symptom that you get from the primary root cause, the primary reason why your pain started to begin with. And that's what you need to figure out in order to relieve some of that posterior hip, lateral hip, buttock pain, maybe some of those sciatic symptoms. So if you've been diagnosed with Piriformis Syndrome and you've gotten treatment and it hasn't worked, and you stretched, you tried strengthening, you tried everything to target that muscle, it may be time to look elsewhere as to what the root cause of your pain is. So give us a call at 904-370-3257 if you've been dealing with this type of condition for a while, and if it's keeping you from moving pain-free and enjoying the activities you love. Look forward to hearing from you soon.